Good evening, ladies and gentlemen. Well, as great as today was and as beautiful as the weather was, y'all can give me something a little bit better than that. Good evening, ladies and gentlemen. What a wonderful evening this is, and we want to, on behalf of the Minority Health Commission, I just want to welcome you here and thank you so much for coming out to hear about the state of minority health in Arkansas. And just want to ask you just to listen in from some really key voices in our community on this issue. Tonight, the Minority Health Commission is joining in with the Arkansas Legislative Black Caucus, as well as the Arkansas Medical, Dental, Pharmaceutical Association to bring you this event tonight. This is the first of what we hope to be a series of discussions that we anticipate having throughout the year to bring greater awareness of Arkansas's public health status as it relates to the minorities in our communities. The Minority Health Commission's enabling legislation defines minorities as African Americans, Hispanics, Asian Americans, and American Indians living within the state. Our ultimate goal tonight, and really for many days to come, working along with the legislature and the governor, is to see a marked improvement in the health of minority citizens living in Arkansas, and to see that improvement in the near future. You know, these statistics have been with us for many, many years, but working together with public health leaders all over the state in a diverse group, we believe that working together now, we can all work and make a difference in the state of Arkansas. We believe it's a win-win. When the status of these minority communities improve, it's a win-win for the overall state of public health in Arkansas. And we look forward to working with our broad public health partners in making these goals a reality together for all Arkansans. This event, again, is sponsored by these three entities who work together on a day-to-day basis dealing with minority health disparities. And the event itself was birthed out of actually just a conversation that some of us were having about our then new chancellor, Dr. Daniel Rahn, being here, and the interest that many of us have noted that he has shown toward minority health disparities. But that small room conversation grew into what you see tonight. Many people were saying to us, no, we want to be a part of that. We want to hear what's happening in minority health disparities. And I want to tell you that we are thinking, and I've only been in this game for just a little while, but I'm hearing that this is the first time that so many partners that deal with disparity issues in the state of Arkansas are coming to the table to sit in the same room and talk about just this one particular issue. And for all of those partners as well to have funding to be able to do this is a really particularly important time in the state of Arkansas when the funds are there to really make a marked difference. So tonight we invite you to hear from some of the key players addressing minority health disparities, and certainly these are just a few. All throughout this room, I see Dr. Thompson here, I see Barbara Cumpy here, I see Claudia Beverly here, I see so many people, and I don't want to get in trouble naming names, but all of these people, all of you that are here tonight have played an amazing role in this issue. And we just want to give a realistic picture of the state of minority health as it stands right now, and introduce to you these agencies and organizations that are directly addressing this complex issue, what their roles are, and to encourage a broader conversation and a broader discourse towards making improvements in the health of minorities in Arkansas. And with that said, it is my distinct honor and pleasure to introduce to you tonight's moderator. She's no stranger to most of us in this room. She served in the Arkansas House of Representatives from 2001 to 2007. And while she was in the Arkansas House of Representatives, she served on the committees for the Judiciary, Aging, Youth, and Families. She chaired the Subcommittee on Higher Ed, State Agencies, and Budget. In her final term in the House, she chaired the Education Committee and served on the Insurance and Commerce, Budget, Personnel, and Energy Committees. She was elected to the Arkansas State Senate in 2008, where she currently serves as Majority Leader. She's a member of the State Education Committee, and she chairs the task force on reducing poverty and promoting economic opportunity. Senator Elliott served, she's a native, of Willisville, Arkansas, so she's one of us. She served as a teacher, as you know, for 31 years, as a high school junior and senior teacher. In 2004, she left the classroom and began working for the College Board, focusing on expanding access to advanced placement curriculum for students who many times were left out of the picture, and for those who were underrepresented in the AP classes, including African Americans, Latinos, rural, and low-income students. As you've heard, Senator Elliott, her background is, we know that she has a tremendous background in education, but what some of you may not know is that she's been a tireless advocate for health equity in the state of Arkansas as well, and has truly been a blessing to the Minority Health Commission in helping us with some things at the legislative level. And tonight I just want you to help me welcome Senator Joyce Elliott as she comes to share with this panel discussion. Thank you.
Well, thank you, everybody. And I know the day has been long and it's late. It would be terrific if I had some jokes to tell you, well, but I don't. And this is a serious subject, and since we have lost some valuable time, I'm going to make an executive decision. I always say if they don't want me to come back, they won't invite me again, but you get a chance when you have the mic to make these decisions. I am just going to, rather than my reading everybody's bio and introducing everybody, when I call on them in just a minute, I will ask each of them to introduce themselves and say briefly what they do and what their hopes and dreams are for the particular committee or the organization that they represent. But I just want to say at the outset how much I appreciate that we are doing this, that we are taking the time, and please notice this word, to introduce some of the advocates, for all of us to have the opportunity to speak to one another briefly among ourselves as we are leaving here. We won't have that chance tonight. But just to skim the surface so that we will know there is much more for all of us to do. I am not one that's about seeing the problems and constantly reiterating the problem. I like to acknowledge the problem and get on with finding solutions. That way, that keeps us all busy doing the work that needs to be done. Because, thank you for that.